After experiencing prolonged abdominal pain, Joellen Spreetzerbach went to her doctor. She wasn't expecting to be diagnosed with suspected ovarian cancer.
I had a breakdown. I totally it was very upsetting. I couldn't go to work for a couple days.
But during Joellen's surgery to treat the suspected ovarian cancer, she received another shock when doctors discovered she actually had cancer of the appendix. Fortunately for Joellen, Riverside Methodist Hospital surgical oncologist Dr. David Arisi had been performing a relatively new and little-known procedure called HIPEC, often referred to as a hot chemo bath. The procedure seemed ideally suited for Joellen.
HIPEC means heated intraperitoneal chemotherapy, and it basically consists of infusing chemotherapy into the abdominal cavity at about 42 degrees for 90 minutes and then removing it.
That's 42 degrees Celsius, about 108 degrees Fahrenheit, a temperature hot enough to kill cancer cells but leave healthy cells unaffected. The hot chemo bath can be used in the treatment of several abdominal cancers, including cancers of the appendix and gastrointestinal cancers. It's an aggressive treatment reserved for carefully selected patients due to risks associated with this therapy.
He put me very much at ease, explaining the procedure to me, and I just felt very comfortable and was not actually worried about having it done at all. Let's get it done, and that's what we did.
On average, the entire procedure takes from 8 to 10 hours. The first part involves the removal of all visible tumors in the abdominal cavity. This is followed by the hot chemotherapy treatment.
There's a machine that heats the chemotherapy and puts it through a circuit, so it pumps the chemotherapy in, and through a different cannula it brings it out of the abdominal cavity, and it circulates for 90 minutes. During this time we actually shake the abdomen to make sure the chemotherapy spreads through the abdominal cavity and any residual tumor cell is bathed by this hot chemotherapy.
Since the chemo is given for a short amount of time, sloshed around in the abdomen and then removed, a process sometimes called shake and bake, hot chemo bath patients don't experience the typical chemo side effects of hair loss, nausea, and fatigue. As for Joellen, the treatment has given her a new outlook on life.
I am cancer-free. I'm just living my life as normal as I can and enjoying every day that I have, with my family.